Okay, so here we go for our third TBL day. Today we're going to look at the gluteal muscles and the thigh muscles. And before we get started, I just want to mention a few brief things about what exactly I'll be looking for with all the muscles that we learn. Okay, on each slide that talks about the muscles, you'll see an origin points. You'll see the exact, very specific origin points, the exact, very specific insertion points, and you'll see the actions of the muscles. Okay, and the things that you really need to focus on, number one, is the action of the muscle. Okay, and the reason I give you the very specific origin and insertion is not so you memorize those exact locations. I'm not really that worried about that, to be honest with you. The thing I'm more worried about is you knowing the general origin and insertion, so you know which joints each muscle crosses, as well as the angle and location of where it crosses over that joint. Because by knowing that, you're going to know what the muscle does. You're going to know its function, and so that's what I want you to focus on. Don't get too hung up on the exact names of the little bony prominences that they originate and insert on. Don't get too worried about that, but you do need to know their actions, and they also need to know the innervation of each muscle, as far as which nerve innervates it. Okay, so we're going to start with the muscles of the gluteal region, and as you know, these muscles are found in the posterior hip, and the general actions here are hip extension, hip abduction, abduction, that means going away from the midline of the body. They also help to stabilize the pelvis during locomotion of the foot that's planted, not the foot that's up in the air. And then there are also hip rotators, both internally and externally, or medially and laterally. An internal rotation will be synonymous with medial rotation, and external rotation is synonymous with lateral rotation. And then we have this special structure called the iliotibial tract, also known as the IT band or IT tract. This is very thick connective tissue. It's joined specifically with the muscle called the Tensor fasciae latae to affect the knee, but it also provides some insertion points for Gluteeus Maximus. And you can feel this big big strip of connective tissue on the lateral side of your thigh, and it goes right down to your knee. Okay, so the first major muscle of the gluteal group is the Gluteeus Maximus. And before I talk about the details of that one, I just want to mention a couple other things at this TBL day, exactly how the TBL day will look. So I'm going to give you the basics of all the muscles here, where they originate, where they insert, the action they have, and the innervation, and then what the questions in the TBL day are going to be much more applied than that. They're going to be giving you a certain action, a certain movement that's going to be done, and asking you which muscles are used in that movement, and kind of taking the information that you have here and applying that to actual functional movements is really going to be more the focus of the questions that you're going to deal with. So don't just think about this in terms of just rotely memorizing things. Think about this in terms of how these muscles are functioning in the body. Okay, so with the Gluteus Maximus, the origination point is very broad. It's on the posterior ilium, sacrum, coccyx, and then it comes down and inserts into that gluteal tuberosity, as well as the iliotibial tract, or the IT band. So again, this is our primary hip extensor. It's a hip abductor, a abductor, and then it's also a lateral/external rotator of the hip, which means the same thing. One thing to note about the hip extension is this is going to be primary hip extensor when we're already flexed, when our hip is already flexed. And so what that means, you can picture yourself walking up a flight of stairs and picture yourself taking your right foot and going, skipping a couple steps and going up higher. Okay, and then when you go to lift your whole body weight up with that right foot after it's already way in front of you, and your hip is way flexed, you're lifting that whole body weight up with that. That's going to be primarily Gluteus Maximus being used on that right side. Okay, Gluteus Medius, as you can see here, is much smaller. It's in the middle of the three gluteal muscles. Gluteus Maximus is most superficial, Medius is right in the middle, and Minimus is underneath that. So this is, again, going to start on the ilium, but more in the posterior ilium, right below the iliac crest, and then it inserts down to the greater trochanter of the femur. So it makes for a perfect line of pull to abduct the hip, abductor. So this is a primary hip abductor. Also, as we talked about in class, on Wednesday, it's very helpful and very useful for pelvic stabilization while walking. And there's a test called Trendelenburg sign when you when you stand up on one foot, if let's say like I did in class today, you stand up on your left foot. If your hips drop to the right side, that means your gluteus maximus is weak, or it's not being innervated for some reason, and that's Trendelenburg's sign when that hip drops down. It's also known as a hip internal rotator. Okay, then we have the gluteus minimus. Gluteus minimus again comes off of the ilium. You can see here just a little bit further down, a little bit more distally, and inferiorly. And it inserts on the greater trochanter of the femur, just like the medius. Okay, it's also a hip abductor, also stabilizes the pelvis, and as well as a hip internal rotator. Okay, and then we've got the tensor fascia lata. Okay, so a long name here, and this one originates off of the anterior superior iliac spine, so it's also known as the ASIS, as you guys have been studying. So right on the front part of the iliac bone. And it comes down and inserts into the iliotibial tract, and then has this really long connective tissue that's going to connect it all the way down to the tibia, and so it crosses that knee joint. So it's very useful in locking the knee into full extension by tightening up the iliotibial tract. It's also a hip abductor. When it contracts, it abducts the hip, as well as medially rotates or internally rotates the hip. Okay. So then switching gears to the thigh muscles. So with the thigh muscles, we have the anterior side, the posterior side, as well as the medial side. Okay, so we're going to split those up kind of by those regions, and you're going to need to know which nerve innervates each region, and then the general actions of each. So that's what this slide will look at. So the innervation of the anterior muscles is by the nerve called the femoral nerve, and the actions on the knee are typically going to be knee extension, whereas the actions on the hip are going to be knee flexion. Hip flexion. So these anterior muscles are knee extensors, and hip flexors. The posterior muscles of the hip are innervated by the sciatic nerve, and the actions are going to be just the opposite. So they're going to be knee flexion and hip extension. Okay, and then the medial muscles are innervated by what's called the obturator nerve. Goes through that big obturator foramen that you guys learned in lab in the bones on that os coxa. And then the actions on the knee are typically going to be none. Most of these do not cross the knee, although a couple of them do, which we'll talk about. But these are primarily your hip adductors. So these are kind of considered your groin muscles that will bring your thighs towards the midline of your body. Okay, so number one here is called the iliopsoas. It's kind of a strange name, and really what this is two separate muscles that come together and have different origination points, but a common insertion point. Okay, so you can see up here we have the iliacus and the psoas major. These are the two muscles here, and then these are going to come together here and both insert on the lesser trochanter of the femur. Okay, so these come off of the T12 through L5, as well as the sacrum, and then they're going to make their way all the way down to the femur. And these are going to be considered a primary hip flexor muscle. Okay, so the quadriceps femoris, these are our quads. When you talk about the quads, these are them. So we're going to look at all four of the muscle names and talk about them a little bit individually. So three of the four muscles all originate on the femur, and then the fourth one originates up on the iliac bone, on the anterior inferior iliac spine. Okay, so the other three all originate on the femur, and that's an important thing to note, because what that means is that these three, the vastus lateralis, vastus intermedius, and vastus medialis, only cross one joint, whereas this one, rectus femoris, crosses two joints because it goes over the hip. Okay, and then they all insert on the patella, and then that tendon goes through the patella because it's a sesamoid bone and connects to the tibial tuberosity to allow for knee extension. Okay, so you can see each of the muscles individually here. One thing you'll note, the names are pretty simple. It tells you kind of where they're at. So vastus medialis, that's the most medial one. The one right in the middle, vastus intermedius, and then the one on the lateral side, vastus lateralis. Normally we can't see vastus intermedius because it's underneath rectus femoris. Rectus femoris is the most superficial. It's going to be right on top of vastus intermedius, and so it's normally hidden by that. In the cadaver, we have the rectus femoris cut, so we can get underneath that and look at vastus intermedius. Okay, so the quadriceps femoris, again, so these are looking at the actions here. And so the rectus femoris is a hip flexor, but it's obviously also a knee extender. So all of them extend the knee, okay, but the rectus femoris, again, is a hip flexor as well because it crosses the hip joint. And so this is the perfect muscle to do this action, kicking a ball. Because when you kick a soccer ball like this, you not only straighten your knee out, but you also flex your hip. You have to do both at the same time. So it's very, very common for soccer players to have quad strains, and a lot of times, it's a rectus femoris strain because of this large, powerful movement that has to happen with a lot of stress on the rectus femoris. Vastus lateralis is the most powerful of these vastus muscles. So all of these are knee stabilizers as well as knee extenders, especially the lateralis and medialis, and it's kind of the balance of those two that's going to help make the patella track right down the center of the femur. If one of those is too strong or one of those is too weak, then they pull the patella to one side or the other, and that can make the underside of the patella rub on those femoral condyles, which leads to something called patellofemoral pain syndrome. That's not the only cause, but that's one of the causes, and that's what this is talking about here, patellar tracking via the balance of those two. Okay, so then another muscle in the anterior thigh is the Sartorius. We've already talked about this one in class a little bit. And this one, like we said, is the longest muscle in the body. Our origin point is the ASIS, the anterior superior iliac spine. Okay, inserts on what's called the pes anserine, or the proximal medial tibia. So you can see it comes down here and inserts right here on this proximal medial tibia. It's called the pes anserine because of the shape. It actually looks like a goose's foot. There's these three different muscles that attach there, that insert there, in kind of a goose's foot pattern. And so you can see it wraps around here and connects down there. So it has a very interesting long path that it takes. Okay, so its actions are hip flexion, hip abduction, and external rotation of the hip. But since it crosses the knee joint, it also has to have an action on the knee joint. So you'll see here on the next slide that it's also a knee flexor. Okay, so remember, any joint that a muscle crosses, it has an action on. Okay, so this would be the way if we wanted to manually test the Sartorius muscle. What that means is what the clinician does is they push force against the person in the exact opposite way that the person is pushing against you. So in this case, to do a manual muscle test of the Sartorius muscle, you have to resist against all of the motions that it does. Okay, so in this case, this practitioner is pushing down, so pushing this person into hip extension there, and while this person is trying to flex their hip, the person is also trying to externally rotate their hip, so they're kind of pushing here with their ankle, pushing into his hand with his ankle, and that's external rotation of the hip, and so he's resisting that. And then also knee flexion, so she's trying to pull her knee back, and he's holding against that. So they're doing all three of those motions at the same time. If you can try to picture kind of what that would look like, then he's specifically trying to target that Sartorius muscle. Okay, muscles of the posterior thigh, primarily known as the hamstrings. Okay, and they're called this because in the butcher shop, when they kill a pig, a ham, they hang them by these big muscles. They put a big hook through the hamstring muscles and hang them by those muscles, and that's why they're called hamstrings. And so all three of these muscles cross both the hip and the knee. So they're all going to have actions on both the hip and the knee. Okay, and so one practical application of these tight hamstrings, since they cross the hip and they connect to the pelvis here. If you have too tight of hamstrings, what this does is this pulls on your ischial tuberosity here of the pelvis, and what that does is that kind of rotates your hip backwards. Okay, leads to some posterior rotation of the hip, which actually leads to your lumbar spine flattening out. Instead of having that nice lumbar curvature that it's supposed to have, it can flatten out the lumbar spine, which then in turn, what that does is that puts more pressure on your discs in the lumbar spine, your intervertebral discs, and that can lead to lots of lower back problems. And so tight hamstrings have a lot of times have a lot to do with back problems. So the general actions of these muscles, again, they're all hip extenders and they're all knee flexors. Okay, so these are the three hamstring muscles starting. So this would be the posterior view of a right leg. Okay, and so the most medial of all of these is called semimembranosus. Okay, and it's covered in a nice shiny thick membrane. That's why it's called that. Okay, so that's the red one there. As we're working our way back lateral, the next one we're going to find laterally is called semitendinosus. And if you go ahead and if you're sitting in a chair and you have your knee at about 90 degrees, if you push back, like try to drive your heel back towards your butt, but resist it on the ground, you'll feel a big tendon pop out on the medial side underneath your knee, kind of right on the bottom of underneath your thigh. That tendon that pops out is semitendinosus. Okay, that's why it's called tendinosis, because it has a big prominent tendon. And then the most lateral hamstring you can feel, again, if you resist your knee flexion again, but kind of rotate your foot to the outside, so do kind of external rotation down there on your foot, and you'll feel another tendon pop out on the lateral side of the back of your knee, and that's biceps femoris tendon. So those are hamstring muscles. Within biceps femoris, it's called biceps because it has two separate heads. A long head here is actually the muscle that crosses the hip, whereas the short head does not. It only crosses the knee joint. It originates on the femur and comes down and crosses the knee. Okay, so there's a better look at biceps femoris. You can see there the long head all the way from the ischial tuberosity down. Short head only crosses the knee because there it is originating on the femur. Okay, and so a couple things that you want to do is you want to be able to differentiate between the actions of the lateral hamstrings, which are the biceps femoris, and the medial hamstrings, which are semitendinosus and membranosus. Okay, so they're all going to be knee flexors. They're all going to be hip extensors, except for the short head of the biceps femoris. But this one, since they all come from the same spot, but since it goes laterally, it's an external rotator of the hip. Okay, and so this is a lateral hamstring. I'm going to show how to stretch all three of these in a couple slides. So the semimembranosus is, again, the most medial of the hamstrings, and this one is going to come down and attach on the medial side. Okay, so again, same origin, ischial tuberosity, medial condyle of the tibia is where it inserts. It's a hip extensor, knee flexor, but this one now is an internal rotator of the hip because of the way the path that it takes. Okay, so semitendinosus, again, is the one that's going to be kind of in the middle of the two, but it's also still going to attach to the medial side of the knee, meaning that it is going to be a hip internal rotator. All the other stuff here is pretty much the same. This is one of the other muscles that attaches that pes anserine. The third one is gracilis. So those are the three muscles that attach to that pes anserine point. And the way I remember that is SGT, kind of like sergeant, Sartorius, gracilis, and tendinosis. Okay, and so yeah, we kind of went through how to feel the two bigger hamstring muscles. Semimembranosus is going to be just medial of tendinosis when you find that, and it won't be sticking down as far. Okay, so the way to stretch each one of these muscles is going to be to move your hip either so you can go straight back like this, which is going to kind of get all of the hamstring muscles. You can go all the way out like this, abduct your hip, okay? And that one is going to target more the medial hamstrings because you're stretching out that medial point more and shortening the lateral, okay? And then if you want to stretch the lateral hamstrings, the biceps femoris, you're going to cross your leg over your body like this, and that's going to stretch out more biceps femoris. Okay. All right, so now with the last muscle group here are the adductors, the medial thigh muscles. Okay, and so these are all very important hip stabilizers as well as leading to hip adduction, adduction towards the midline. Okay, so number one here is called the pectineus, and this one is actually innervated by the femoral nerve, which is an exception to what I told you at the beginning. Most of these muscles are innervated by the obturator nerve, but this one is different. This one is femoral nerve. Okay, so this is going to start right around the pubic bone. Okay, and then this one's going to come in and insert right on the femur. So it's very short, small little muscle, but it's pretty thick. It actually provides a decent amount of force. It's a hip flexor as well as a hip adductor. Okay, number two here is adductor longus. Okay, we've got a few muscles that start with the name adductor. So adductor longus is going to be here. Okay, and it's just a pure hip adductor. Gracilis is the one I already mentioned, so again it's going to insert on that pes anserine point. This is the G of that sergeant, SGT. Second longest muscle in the body, another nice long parallel fascicle arrangement. It's going to go from the pubis again, come straight down, go to that pes anserine. So it's going to be primarily a hip adductor, but also a knee flexor since it crosses the knee. Okay, and then we've got adductor brevis. So adductor brevis is going to be found just proximal to adductor longus. You can see longus here and brevis here. So again, this one's going to be a pure adductor of the hip. And then finally, the biggest of these adductor muscles is adductor magnus. This is a very large muscle, very important for hip adduction and any rapid movements that require hip adduction, like kicking a ball. If you can think of kicking a soccer ball and using the inside of your foot, doing that with a lot of force requires a lot of strength from the adductor magnus muscle. And this one sits behind the other two. Adductor longus and brevis kind of sit on top of this, and this one is posterior to those.